Hey everybody, hope you're doing well and staying safe amidst all of the recent developments that have been occurring as a result of the new coronavirus, COVID-19. It's the first video I guess I've made since spring break as well, so I hope you've all enjoyed your spring break and wanted to give a quick update on what we're seeing as far as this virus. So I made a video a couple of weeks ago that hit on this when it was in really early stages of coming over to the United States. It was still, at the time I had made the video, um, mostly a concern in China, and now becoming a very big concern for us here in America and Europe. And so I wanted to try and cut through a little bit of the noise. So if you're like me, you've been seeing a lot of posts and opinions and information being shared on social media, maybe as well as the mainstream media too. And I wanted to take the time to try and give a really clear picture of what this virus is doing and why we're taking some what seem like extreme measures to try and slow this down. So a couple weeks ago, I did make a video and had compared the coronavirus to the flu. I just want to say that my intention for that video was not to minimize the severity of the coronavirus, but was more to highlight the severity of the flu. That the flu is something that we kind of maybe brush off every year, that not that big of a deal, but it doesn't end up hospitalizing and being the cause of death for a lot of people every year. So anyway, what's the big deal about the coronavirus? Everything's getting shut down, sporting events being canceled, your classes have been, face-to-face classes at least, have been suspended for the next week. So why taking all these measures? So let me just start off by saying a lot of the data that we have right now is the best that we can do. So we're not going to have really accurate data on this new coronavirus for quite some time. So we're doing the best that we can right now with the data that we do have. But what we do know is that uh, this is a virus that is not quite as deadly as some of the other epidemics that we've seen recently, such as Ebola, MERS, and SARS. So the case fatality rate, that's a rate of all the people that get this disease, how many people die from that disease. So for COVID-19, it's going to be, we're seeing rates somewhere around 4 to around 1. So the estimate that's usually given around is about 1%. So 1% of the people that are getting this disease are dying from it, which doesn't seem like that big of a deal. But if we start to extrapolate that out across the millions of people that could potentially get this disease, 1% ends up being tens of thousands, maybe hundreds of thousands of people. So that's one of the reasons why the concern is as high as it is. So if you look down at the seasonal flu, which the case fatality rate for the seasonal flu only at 0.1%. So COVID-19 is at least 10 times more deadly from what we're seeing than the seasonal flu. So you're going to see me compare this a lot to the flu through this video, and that's because that's what I've been seeing a lot through some of the posts on social media that I've been making, some of the things I've been hearing on the radio and on the news. So you'll hear me kind of comparing this a lot to the flu. Um, so a little bit more on the death rate. So who are the people that are most impacted? Fortunately, a lot of infectious diseases end up impacting the very young and the very old at about the same uh, level of severity. For whatever reason, we don't quite know this yet. This is a disease that's not affecting younger populations in the same way that something like the flu does. However, it is affecting older populations by a lot and affecting people that have pre existing conditions. So, people that have lung disease, cardiovascular disease, people that have some of these pre existing conditions. So, the older populations are definitely the people that we see that are most at risk for having a lot of complications from COVID-19. So, like I said, all of the estimates that we're seeing, there's a significant margin of error. So, we're doing the best that we can with this data. So, as I'm going through this video, I'm going to try and hit on the most conservative estimates that we have. And even by the most conservative estimates, this is still a really serious public health issue. So in China, about close to 15% of those that are 80 years and older are dying from this disease. So really putting people that are the elderly and the infirmed at a big risk. And so what about how contagious this disease is? So I put in these measures of the contagion factor. And so that's R naught, and that's looking at, or it's a measure for how many people are expected to contract this disease based on how many people that are in contact with you. So if you have an R naught of 1, that means for every person that's infected, they're expected to pass that disease on to one other person. So if it's greater than 1, then the disease is going to start to spread rapidly. So you can think of one person infects 2 other people. Those 2 people infect 2 more people. So that's 4 people to 8 to 16 to 32. And you can see how it can start to grow exponentially really fast. So if you have an R naught, though, that's less than 1, the disease is eventually going to start to fizzle out. And so that's what we're hoping to do with some of these measures, is to bring that R naught below 1 for COVID-19 so that we can start to see this disease transmission start to slow. So the information that we have now, we don't exactly know how contagious this disease is, but by all the estimates that we have, this disease is also much more contagious than the flu. So I gave some of these numbers recently about the flu, and so these are some more updated numbers for what the flu season has been like this year. So the flu has caused millions of illnesses, millions of medical visits. It's also caused hundreds of thousands of hospitalizations, tens of thousands of deaths. So flu season is not over. These numbers are probably going to go up a little bit more. Again, these are some estimates, so I'm going to be using some of the conservative estimates here. Influenza is not a mandatory reported disease, so we have to make a few estimates here. So I want to point out a couple of things. First, hospitalizations and deaths are in great number, and let me just say that we do take the flu seriously. A lot of the measures that we take as far as trying to get people vaccines, getting people tested very quickly. So most of the time, if you go to the doctor's office during flu season, you're showing symptoms, you can get a test right then, you get your results pretty much immediately. And if you test positive for the flu, they're going to give you instructions to stay home from work, quarantine yourself for a week. So a lot of the measures that we take for the flu are to try and slow the spread down. So I want to also highlight that these are all estimates that have taken place over the course of about 6 months. Okay? So that's a really important point to make, that even though we're seeing really great numbers for the flu as far as hospitalizations and deaths, the reasons that we don't take these kinds of extreme measures that we're taking for COVID-19 is because this is a process that we slow the transmission in such a way that it's not overburdening the health system such a point that we can't handle it. So what might this look like for coronavirus if we keep comparing it to the flu? So even by some conservative estimates, COVID-19 does appear to be more contagious and more deadly than the flu. So at least 5 to 10 times more deadly. Some estimates are having about 30 to 40 times. So if we extrapolate those numbers out using some of those flu numbers, just to compare that to the flu, there's 350,000 hospitalizations. We're looking at closer to 2 million hospitalizations. The 20,000 deaths, if we multiply that by 5, at least 100,000 deaths. And again, these are really conservative estimates. And to put this in a little perspective, the United States currently has 924,107 staffed hospital beds. So this is the reason why this is such a serious issue right now. We are attempting to slow the spread in such a way that we do not overburden our health system to where we don't have the resources to be able to take care of the people that are getting sick. So a couple other reasons why this is such a serious issue is it is occurring at the same time that the flu season and seasonal flu is still causing some issues, so it makes this particularly difficult, as well as a really long incubation period for COVID-19. And so the incubation period is period from when disease onset to when you start to show symptoms. So some people are going for up to 2 weeks of the period between their exposure to when they start to show symptoms. And that becomes really problematic because you might be feeling fine, you might be asymptomatic, and you might be coming in lots of contact with other people and not feeling sick. And during that time, you're spreading that disease to a lot of other people. So, another challenge that comes from this new coronavirus. So, a lot of you may have seen this graphic. It's being passed around a lot. And this is uh, really the perfect graphic that I can think of to show you of why this is such a serious issue. So, if we allow a disease like the coronavirus to spread in such a way that we kind of just let it go unchecked, we're looking at this red curve there. So, at that point, disease transmission is occurring so rapidly that there are more people that need care than our health system can handle. Again, even considering the really low risk of death um, and even considering the low rate of um, kind of severity of this disease, especially for a lot of you in this class, when you start to spread those numbers out, that 1% death rate and those really small percentages of people that need hospitalizations. When you start to consider an entire population for that, those numbers get really big. And if those numbers get so big that our healthcare system can't handle it, then we have to start making really difficult ethical decisions. And I'm going to get into that in a second. But the idea here is to slow the spread in such a way that our healthcare system can give adequate treatment to everybody that needs it with the disease. Then they don't have to try and give adequate health care to everybody at the same time. And so we're seeing in Europe right now a spread that's pretty massive. So Europe is kind of the epicenter of this disease right now. So Italy is being hit especially hard. It appears to have the highest death rate. So the death rate is about 6%, which is larger than really anywhere else that we've seen. So you may have noticed that in the president's address on Wednesday, there was a travel ban that was announced from 26 European countries, including Italy. The United Kingdom and Ireland, they were mysteriously exempt. As of today, they have also been included on the travel ban. A couple things about the travel ban. Most of the disease transmission that's going to occur is going to be community transmission, which means it's going to be cases that are spreading from person to person that are already here in America. So, in public health opinion, travel ban isn't going to be incredibly effective at slowing down the spread. So, what's going to be most effective right now for slowing down the spread are a lot of the measures that are already being taken, as far as shutting down large events, shutting down face-to-face classes like UNCG and the UNC university system has done. So I want to highlight Italy right now. And Italy is an example of why this disease is so serious. So Italy has started to set up emergency checkpoints where they're having to make incredibly difficult and morally and ethically difficult decisions because of how this disease is impacting their health system. So they released a document this week, top doctors in Italy, that are recommending that as they're treating this disease, those with the highest likelihood of survival to be treated. So rather than most hospitals that just treat people, for the most part, first come, first serve. There's a little bit of triage in like emergency departments, but they're having to make decisions where people that are coming in that may be much older aren't getting the kind of care that they would normally get because they're having to use their resources on people that have a more likely chance to survive. So they're treating younger patients, treating those that are healthier, those that with the greater chance to survive. And so that's in taking some of the measures that we're taking here, we're trying to avoid a situation like we're seeing in Italy right now, where our resources become so stressed that we're not able to allocate the resources to everybody that needs them, and we're only allocating the resources to those that we think would have the highest chance of survival. Which, if you're like me and as you've heard that and you've read that, it sounds truly awful that this is the decisions that people have to make, and the kind of and yeah, the ethics that go with that. So the measures that we're taking right now may seem extreme, especially considering that, again, for a lot of y'all are going to be, if if you got COVID-19, chances are you're going to recover and be fine. But this is a public health issue, so that's why we're taking some of the measures that we are. So what does this mean for you? It's personal health course, so I want to hit on what this actually means for you. So first of all, like I've been saying, you're young, you're healthy, there's no need to panic for you personally. So if you contracted COVID-19, chances are that you're going to make a full recovery based on what we know about this disease right now. So death rates for young and healthy populations is still extremely low. But we have to consider that this is a public health crisis, and it's going to require things to be done that promote the common good. So even if you are not personally going to suffer from coronavirus, you having coronavirus is putting everyone else that's around you at risk. And then by putting all those other people at risk, you're putting all the people that they may be in contact with at risk too. So what we're trying to do is keep these people from being a chain in this, or a link in this transmission chain. So to keep you from putting some of the elderly at risk, to keep you from putting someone who is about to go see their grandparents at risk, or to go see someone who's got COPD or asthma at risk. So these measures are really trying to prevent the contact for person to person, to try and slow down this transmission. So for me, am I worried about me personally getting COVID-19? Not really. I'm actually not that worried. If I get it, I'm fairly confident that I'm going to recover. I'm going to be okay. Am I concerned about being a link in that transmission chain and passing it on to other people that would not have a chance to recover? Absolutely. And so that's where this concern is coming from. So none of the steps for you have changed. So make sure, wash your hands, don't touch your face. Some of the new measures that are taken now are social distancing. So that's a term you've probably been hearing a lot. So avoid and limit your time in public spaces. So a lot of that's being done already from the university, cutting down face-to-face classes. So I just say at this time right now, do your best to avoid social outings, at least big social outings, as much as you can. As far as visiting with a couple friends or seeing your family, I would encourage you to do that actually. And to in light of some of the things we talked about last week, make sure you maintain some good social connections. But as far as social outings where you're going to be in contact with lots and lots of people, try to limit those as much as you can. So if you do think you've been exposed, you think you're experiencing some of the symptoms from coronavirus, I would encourage you to call your doctor first. Don't just show up and try to make an appointment. Call your doctor and let them go through some of the steps on what you can do. And some of this is changing too with the declaration of the national emergency. I know they're trying to set up some testing sites and everything. Testing for the coronavirus has been slow at best, so they're doing their best, I think, to hopefully doing their best to ramp up this process a little bit to make sure that everyone can get tested so we can take the steps that we need here. So just make sure that you're calling your doctor and let them go through the steps that they want you to go through. So here's a few of the symptoms that you can look out for. It's going to be a fever, a cough, and a shortness of breath. So these are some of the really common symptoms that you're seeing. So let me just point out too, we're about to hit allergy season. We're coming through flu season too. So a lot of the symptoms may be similar to some of these other conditions. So just make sure that you're in contact with your doctor. If you're worried that you've been exposed or worried that you may be experiencing these symptoms, just talk with your healthcare provider and just continue to practice good hygiene tips, washing hands, and making sure that you're limiting your contact with the public. So hope this made sense. Hope this kind of cut through some of the noise that you're hearing. Hope this highlighted why this is such a serious issue and kind of unprecedented. We haven't seen this in the United States in quite some time. Um, so yeah, if you have any questions about this, I would encourage you to reach out to me or go to the World Health Organization website, go to the CDC website. Like we talked about, some of these reputable websites that you can go to, .gov websites that are going to help you understand this a little bit more. I also post a article that was just released yesterday from the UNCG news page. So they interviewed Dr. Rousquin, who is a professor in our department, and she also talks a little bit about this. She's a social epidemiologist and has some experience with this and some good information. So, yeah, I encourage you to read that, and I'll post that. So, I guess I'll just leave with saying that this is not a time for you to necessarily personally panic, but make sure that you're doing your part to slow down the spread of this disease for yourself and for those around you.